হ্যালো ফ্রেন্ড, আশা করছি তোমরা সবাই খুব ভালো আছো এবং সুস্থ আছো। বন্ধুরা, আমরা অলরেডি আগের ভিডিওতে পোস্ট বেসিক বিএসসি নার্সিং এন্ট্রান্স এক্সামের 2024-এর প্রথম 50টি কোয়েশ্চেনের অ্যান্সার উইথ ফুল ডিটেলস দেখে নিয়েছি। আজ আমরা বাকি 50টি কোয়েশ্চেনের অ্যান্সার উইথ র্যাশনাল দেখে নেব। এবং যারা এখনও পর্যন্ত চ্যানেলটি সাবস্ক্রাইব করোনি তারা এখনই চ্যানেলটি সাবস্ক্রাইব করে বেল বাটন দিয়ে দাও এবং পরস্পর কোয়েশ্চেন অ্যান্সার প্র্যাকটিস করতে থাকো। Question number 51. The single most important hormone for maintenance of effective and continuous lactation, option A oxytocin, option B estrogen, option C prolactin, or option D progesterone. And here the right answer is option C prolactin. Prolactin is necessary for the secretion of milk by the cells of the alveoli. The level of the prolactin in the blood increases markedly during the pregnancy and stimulates the growth and development of the mammary tissue in preparation for the production of milk. The dose of anti-immunoglobulin for a Rh-negative mother after the birth of the baby 50 microgram, 100 microgram, 200 microgram, or option D 300 microgram. At least 300 microgram of anti-D within 72 hours of the delivery is given to the mother. So here the right answer is option D. Question number 53. Umbilical cord which attaches to the edge of the placenta is called villamencus insertion, placenta suction choriata, bacterial placenta, or option D placenta incluata. And here the right answer is option A villamencus insertion. Umbilical cord is attached to the edge of the placenta is called the villamencus cord insertion. Question number 54. The scientific study of human population is termed as census, demography, vital statistics, or option D survey. And here the right answer is option B demography. Demographers use the statistical methods and models to analyze human populations, including their size, structure, and distribution. They also study how this population change over time, including births, deaths, changes, the legal status, childbearing, disease, disability, and education. Question number 55. A nurse would advise the patient to avoid salt substitute and foods such as banana, tomato, and orange juice for the following disorders: hyperkalemia, hypokalemia, hypomagnesemia, or option D metabolic acidosis. And here the right answer is option A hyperkalemia. Hyperkalemia is already potassium level is high, and these fruits like the banana, tomato, and the orange juice have the high potassium level, so avoid this in case of the hyperkalemia. Question number 56. Absence of the following clotting factors leads to hemophilia A: factor 7, factor 8, factor 9, or factor 10. Deficiency of clotting factor A leads to hemophilia A. Hemophilia A is a hereditary bleeding disorder that occurs when there is a lack of factor 8 clotting activity. This prevents blood from clotting properly, resulting in excessive and prolonged bleeding after the injury, surgery, or tooth extraction. So here the option B is the right answer. Question number 57. A client weighing 76 kg is admitted in emergency department with 40% burn. Using Parkland formula, client's 24 hours IV fluid replacement should be 6080 ml, 9120 ml, 12160 ml, or option D 15180 ml. Parkland formula consists of 4 ml per kg per percentage of TBSA or total body surface area burn of ringer lactate for the first 24 hours. So, by using this formula, 4 ml into 76 kg into 40% of burn total body surface area is equal to 12,160 ml. So, here the right answer is option C. Question number 58. The purpose of maintaining nothing but oral for 6 to 8 hours before the surgery is to prevent the vomiting, to prevent electrolyte imbalance, to prevent the pulmonary aspiration, or option D to prevent the urination. Nothing but oral helps to prevent the inhalation of stomach content into the lungs, which can lead to pneumonia and other serious health issues. The purpose of maintaining nothing but oral or the nothing by mouth for 6 to 8 hours before surgery is to reduce the risk of complication during and after the procedures. Question number 59. Practices that have been repeated by a multitude of generation. Practice is referred to law, habits, customs or option D, culture. Practices that have been repeated by many generations are known as customs. Customs are socially accepted ways of doing things that are passed down through generations. They are often followed unconsciously and are an effective way of informal social control. Question number 60. In India, the most rigid system stratification is class, caste, estate or slavery. And here the right answer is option B, caste system. The caste system is a closed social structure that divides people into rigid hierarchical groups based on their birth. People are born into caste and cannot change their social standing throughout their lives. The caste system determines many aspects of person's life, including their occupation, marriage partner, and housing. Question number 61. Social change refers to change in individual values, change in the values of the society, change in technology, or option D, change in census. Social changes in the alteration of a society's social order, which can include the changes to social institutions, behaviors, or relations. It can also be defined as a change in human interaction and relationship that transforms the cultural and social institute. Social change can be driven by a variety of factors, including culture, technology, conflicts, geographical conditions. Question number 62. Silver nitrate dressing may cause increase the creatinine level, depletion of sodium and potassium, increased burn, or increase the potassium level. Silver nitrate dressing can cause a number of side effects, mainly depletion of sodium, potassium, or the chloride, especially if it's used for a long time or as a wet dressing, and others are skin staining, skin irritation, allergic reaction, toxicity, and skin burns. Question number 63. Sign and symptoms of digoxin toxicity, convulsions, vertigo, yellow vision, or muscle cramp. In case of the digoxin toxicity, patient may report the visual symptoms which classically present as a yellow-green discoloration, and sometimes the cardiovascular symptoms such as the palpitation, dyspnea, and syncope also seen. So here the right option is option C. Question number 64. Diabetes insipidus is caused by the deficiency of antidiuretic hormone, insulin, glucagon, and renin. And here the right answer is option A, antidiuretic hormone or ADH. Diabetes insipidus is caused by a deficiency antidiuretic hormone, also known as arginine vasopressin (AVP), which prevents the dehydration or the kidney's inability to respond to ADH. ADH enables the kidneys to retain the water in the body. The hormone is produced in a region of the brain called the hypothalamus. Question number 65. According to Piaget, egocentrism is the features of which of the cognitive development? Concrete operational, pre-operational, formal operational stage, or sensory motor stage? According to Jean Piaget, egocentrism is a features of the pre-operational stage of cognitive development. The pre-operational stage is the second stage of the Piaget's theory of cognitive development, and it occurs between the ages of the 2 to 7. Children in the pre-operational stage think at the symbolic level, but they are limited to their own experiences. Question number 66. In which of the following type fracture the bone is shattered into numerous fragments? Greenstick fractures, avulsion fracture, communicate fracture, or displaced fracture? And here the right answer is option C, communicate fracture. A communicate fracture is a type of bone fracture where the bone is broken in 3 or more pieces. Communicate fractures are caused by severe trauma such as a car accident. They tend to heal more slowly than other types of fracture. Question number 67. Immediate treatment of dog bite, hospitalization, application of antiseptic, wash the wound with soap and water, or suturing. And here the right answer is option C, wash the wound with soap and water. And warm running water for 3 to 5 minutes. Next, question number 68. Which of the following is a screening cask for balance? Rennie cask, Weber cask, Allen cask or Romberg cask? And here the right answer is option K, Romberg cask. This cask assesses a person's sense of balance by removing the visual and vestibular component that help maintain balance. It can help identify a neurological condition related to proprioception. Question number 69. Another term for reinforcement is stimulus, reward, response or condition. And here the right answer is option B, reward. Reinforcement is another word for reward. Reinforcement learning is a feedback-based machine learning technique in which an agent learns how to behave in a given environment by performing action and observing the outcomes of those actions. Question number 70. In metabolic process, vitamin D is absorbed in stomach, small intestine, large intestine or sacs from the stomach and ends in large intestine. Vitamin D is absorbed in the small intestine, primarily in the jejunum and ileum. The absorption process occurs through simple diffusion and by carrier proteins in the intestinal membrane. The presence of fat in the gut can enhance the vitamin D absorption. To prevent neural tube defects in a baby, which nutrient is given as supplementation for the mother during pregnancy? Calcium, iron, folic acid or magnesium. To prevent neural tube defects in a baby, the mother should take 400 microgram of folic acid daily before and during early pregnancy. Folic acid is a form of folate and vitamin B that helps the body create new cells. So here the right answer is option C, folic acid. Question number 72. Which is also known as the accessory dietary factor? Fats, vitamins, protein or option D, hormones. The accessory dietary factor is also known as a vitamin. The term accessory food factor was originally used to describe an unknown substance that was found in small amounts in some foods such as milk and was necessary for the body to function. So here the right option is option B, vitamins. Question number 73. Index of duration of malnutrition is weight for height, height for age, weight for age or option D, none. Commonly used anthropometric indices or measurements for nutrition surveillance are weight for height or length. For waist gain, mid upper arm circumference for acute malnutrition and edema for edematous malnutrition is also known as the kwashiorkor. Height or length for age is known for stunting and weight for age. So here the right option is option A, weight for height. Question number 74. The ability to tolerate frustration is an example of one of the function of the ID, ego, superego or unconscious. We can tolerate the frustration because of the function of the ego. The ego, according to Sigmund Freud, the psychoanalytic theory, is responsible for mediating between the ID and the superego. Question number 75. The another term for superego is self, ideal self, narcissism or option D, conscience. And here the right answer is option D, conscience. Superego can function on 3 levels of consciousness: unconscious, preconscious and conscious. Question number 76. The specific abilities are measured by achievement test, aptitude test, intelligence test or option D, occupational test. The specific abilities are measured by aptitude test, which assess a person's ability to learn and perform the specific task. They can be used to assess a variety of abilities like the clerical speed, mechanical reasoning, teaching aptitude, music aptitude, science aptitude, painting aptitude and mathematics aptitude. IPV is which type of injectable vaccine? Killed, live attenuated, inactivated or toxoid. IPV is an injectable vaccine that protects against the polio. IPV stands for inactivated poliovirus vaccine, which is a shock that contains a killed poliovirus. It's the only polio vaccine that's been used in the United States since 2000. Question number 78. Ophthalmia pneumoniarum in newborn is caused by Neisseria gonorrhoeae, Neisseria meningitis, Haemophilus influenza, or Streptococcus pneumoniae. Ophthalmia pneumoniarum or the neonatal conjunctivitis can be caused by a number of microorganisms, mainly Neisseria gonorrhoeae. Question number 79. Which type of mediate type 1 hypersensitivity reaction? IgA, IgD, IgE, or IgG? The type 1 hypersensitivity reaction are mediated by immunoglobulin IgE antibodies. IgE antibodies bind to the receptors on the mast cell and basophils, causing them to degranulate and release the chemical mediators like the histamine, serotonin, and other inflammatory mediators. Question number 80. In the natural history of disease, the pathogenesis phase is deemed to start upon the entry of the disease agent in the human host, interaction between the aging host and environmental factor, appearance of signs and symptoms, and appearance of complications. The pathogenesis phase of a disease begins with a disease agent enters a susceptible human host. After the entry, agent multiplies and induces tissues and physiological changes. The disease progresses through the period of incubation and later through the period of early and late pathogenesis. So here the right answer is option A, entry of the disease agent in the human host. Question number 81. The morbidity in a community can best be estimated by active surveillance, sentinel surveillance, passive surveillance, or monitoring. And here the right answer is option A, active surveillance. Active surveillance is used for urgent surveillance reports on non-targeted disease that are not in the routine reporting system. It often involves the special teams making visits to determine the incidence of an emerging disease. Question number 82. The response to iron replacement therapy is indicated by an increase in hemoglobin level at the rate of 2 gram per week, 1 gram per week, 1 gram per month, or 2 gram per month. And here the right answer is option D, 2 gram per month. The usual benchmark for successful iron supplementation is 2 gram per GL increase in the hemoglobin level in 4 to 8 weeks or 1 month. Question number 83. The ability of a class of microbes to produce the disease is referred as virulence, pathogenicity, commensals, or infection. The ability of a microbes to cause the disease is called the pathogenicity. Pathogenicity is a qualitative measurement meaning that an organism either can cause the disease or not. Pathogenicity is an ability of microorganism to produce a disease. Question number 84. Koplik spot on the buccal mucosa is a characteristic feature of mumps, measles, rubella, or respiratory syncytial virus. Koplik spot on the buccal mucosa are a characteristic features of measles. Koplik spots are small, white or grey, the specks that appear on the inside of the cheeks and often on a raging background. They are usually found opposite of the second molars but can sometimes extend across the entire buccal mucosa. Question number 85. BIA is a method of screening for cancer is the oral cavity, cervix, gastric, or prostate. The VIA or the visual inspection with acetic acid is a method of screening for cervical cancer. The WHO recommended that the women be screened every 3 years using VIA with priority given to women aged 30 to 49 years. So here the right answer is option B, cervix. Question number 86. Which of the following centers are now known as Health and Wellness Center, HWC? CHC, District Hospital, Subcenter, or Rural Hospital? A subcenter is now known as Ayushman Arogya Mandir, the subcenter. In 2018, the Government of India announced the creation of Health and Wellness Center by converting the existing subcenter and primary health center. The goal was to deliver the comprehensive primary health care services to the community. Question number 87. The endemic disease means that a disease occurs clearly in excess of normal expectancy, is constantly present in a given population group, exhibit the seasonal pattern, or option D is prevalent among the animals. A disease outbreak is endemic when it is consistently present but limited to a particular region, and this makes the disease spread and rates predictable. Malaria, for example, is considered the endemic in certain countries and regions. Question number 88. The live attenuated vaccine is COVID-19, typhoid, IPV or OPV. A live attenuated vaccine, ALAV, is a vaccine that uses a weakened form of a disease-causing germ to trigger a strong and long-lasting immune response. So here the right answer is option D, OPV. Or oral polio vaccine is the live attenuated vaccine. The Hansen disease is also known as leprosy, filaria, yellow fever or plague. Hansen disease is also known as leprosy. It is chronic infectious disease caused by Mycobacterium leprae. Question number 90. Which is the most peripheral public health center where the safe blood services are invoiced under IPHC? The Indian Public Health Standards. PHC, CHC, Sub-District Hospital or District Hospital. And here the right answer is option B, CHC, Community Health Center. Question number 91. Which of the following scheme provides the cash assistance? जननी शिशु सुरक्षा योजना, JSSK, राष्ट्रीय किशोर स्वास्थ्य कार्यक्रम, RKSK, जननी सुरक्षा योजना, JSY, or राष्ट्रीय बाल स्वास्थ्य कार्यक्रम, RBSK. And here the right answer is option C, जननी सुरक्षा योजना. JSY is a centrally sponsored scheme which integrates the cash assistance with delivery and post-delivery care. Question number 92. The emergency contraceptive pills should be used within a maximum period of 24 hours, 48 hours, 72 hours or 96 hours. The emergency contraceptive pills must be preferably taken within 72 hours of an unprotected act of intercourse. The earlier, the better. Question number 93. Vitamin K given to a newborn weighing 900 gram is 0.5 mg, 1.5 mg, 1 mg or 2 mg. All newborn with birth weight of 1000 gram or more should be administered 1 mg of vitamin K IM, while the weighing less than 1000 gram should be receive 0.5 milligram dose. So here the right answer is option A, 0.5 milligram. Question number 94. The hormone responsible for milk ejection is oxytocin, estrogen, progesterone or prolactin. The oxytocin is the hormone responsible for milk ejection, also known as the leg down reflex, and the prolactin is necessary for secretion of milk by the cells of the alveoli. Question number 95. Peking ductus arteriosus is an abnormal communication between the pulmonary artery and pulmonary veins, pulmonary artery and aorta, pulmonary vein and aorta, pulmonary vein and coronary artery. PDA or Peking ductus arteriosus is the persistence after the birth of the normal fetal connection ductus arteriosus between the aorta and pulmonary artery, resulting in a left to right shunt. So here the option B, pulmonary artery and the aorta is the right answer. Question number 96. The red colored inverted triangle at the center of the under 5 logo that represent care in illness, immunization, early diagnosis or family planning. And here the right answer is option D, family planning. Question number 97. Flag sign is a sign in which the following nutritional disorders: marasmus, kwashiorkor, underweight or nutritional dwarfism. The flag sign is a characteristic feature of kwashiorkor, a severe form of protein malnutrition. The flag sign in dermatology hypopigmented bands of scalp hair alternating with the normal dark hair. Question number 98. As per National Immunization Schedule, at which age OPV booster to be given? At 14 to 16 weeks of age, at 10 to 12 months of age, at 12 to 15 months of age, or at 16 to 24 months of age. And here the right answer is the 16 to 24 months of age. So option D is the right answer. Question number 99. A 2 years child having the respiratory rate 50 breaths per minute with cough and cold, at which classification of pneumonia the child belongs to? Pneumonia. So option B is the right answer because of the respiratory rate 50 breaths per minute with cough and cold, but here no chest ingrowing is present. And the last question is, the pelvic harness brace is most commonly used for knee deformity, finger deformity, CGH, congenital dislocation of hip, or spinal deformity. A pelvic harness is a soft brace used to correct the hip disorders and broken thigh bones in babies and infants, mainly dysplasia of the hip (DDH). It helps to keep the infant's hip and knees bent and the thighs spread apart. It can also help promote healing in babies with broken thigh bones or femurs. So option C, CGH or congenital dislocation of the hip is the right answer. তো বন্ধুরা, এই ছিল আমাদের আজকের ভিডিও। আশা করছি ভিডিওটা তোমাদের ভালো লাগবে এবং কাজে লাগবে। অ্যান্ড থ্যাংক ইউ ফর ওয়াচিং দিস ভিডিও।